Good afternoon, everyone. This is Natalie, Ellis, and we are here on Ask the Therapist. And today our topic is going to be about postpartum. Okay, postpartum more than depression, but depression, postpartum is a subset of depression. Okay, so we're going to talk about postpartum. And just to give you a little bit about myself again, I'm Natalie Ellis. I'm a licensed professional counselor in the state of Georgia. I have a private practice in the Decatur, Georgia area where I see clients from children as young as 3 to adults as young as 75 and older. So in my practice, I work a lot with people who have depression, anxiety, trauma, who's had adverse experiences in their lives and has been traumatized. And so I do all kind of treatments to kind of work with them in dealing with their depression, anxiety, their trauma, their behavior issues, and so on. So this is great. So I wanted to talk about postpartum. This is International Women's History Month. Women's History Month, and so I just wanted to kind of talk about just women issues overall, and again, as women, dealing with childbirth is something that comes up for us, and I want to talk about postpartum. And one of the things as I was doing research about postpartum, it's really a high percentage of women in the U.S. globally, but then we're going to focus on the U.S. that experience postpartum, okay, or postnatal depression or postpartum depression. 11 to 20% of women experience this. That's a high number of women. So with every childbirth, a high number of women experience postpartum. And that doesn't even include, I'm not even sure if that includes, and I'll have to do more research on that. This is childbirth in regards to delivery per se, but, you know, a lot of women who experience miscarriages or failed deliveries and things of that sort. And so infertility and all those things that go into play with miscarriages and all that. And so your body's still going through those changes. And so postpartum may occur as well. Because with some miscarriages, you still have to go through the process of delivering. And so, yes, so CDC says 11 to 20% of women experience postpartum. So I wanted to talk about that. Okay. So there's a couple things. So you often hear about baby blues. And baby blues, again, is a lighter version of postpartum depression. So baby blues usually occurs a few days after childbirth, and it lasts a week and no more than 2 weeks. Okay. With a lot of diagnosis, when we're noticing something is lasting longer than 2 weeks, a month, then that's something we have to get checked out. Okay? Because again, once it's lasting for an extended period of time, 2 weeks, a month, then we may want to see if there's something else contributing to that, or if there's other things going on. Okay? And so if baby blues are lasting more than 2 weeks, then we need to be concerned that it may be postpartum. And so baby blues, the symptoms of that, or some of the signs of baby blues, is mood swings, anxiety, sadness, irritability, feeling overwhelmed, crying spells, okay, reduced concentration, poor appetite, trouble sleeping. And so those are things with baby blues. And some of that naturally so because of recent childbirth, the exhaustion from that, and having to take care of a newborn baby, and so some of that could be a part of that with the baby blues, okay? But when we're noticing that, it's been more than 2 weeks and we're still experiencing some of this, then we have to ask ourselves, is it something more than that? So postpartum is looking at things that may start occurring right after childbirth, but then if it's lasting, these are things past 2 weeks, then we need to be concerned. Okay? So, of course, postpartum is defined as a mood disorder after childbirth. Okay? And it's lasting, like I said, 2 weeks or more. Anything 2 weeks or more, we need to pay attention to that. And so the symptoms of postpartum, again, unlike baby blues, these symptoms are there, but they're not as big. But with postpartum, imagine that these symptoms are bigger. You're feeling it more intensely in the body. You're feeling it, the irritation, everything is just more intense. And so we have mood swings, severe mood swings, where our mood is shifting up and down very, very quickly. Depression, where the depression may occur and it's really intense and severe. Excessive crying, difficulty bonding with the baby, intense irritability. And so postpartum versus baby blues, again, the intensity in postpartum in terms of these symptoms. Difficulty bonding with the baby, intense irritability, hopelessness, thoughts of wanting to harm self or the baby, fear you're not a good mother. Those could be thoughts going through your head, fear you're not a good mother, inability to think clearly, okay, reoccurring thoughts of suicide. So those are different things in regards to postpartum. Again, the feelings are more intense. And so we look at baby blues, and then we also have to see if it's more than 2 weeks, and if those symptoms of anxiety, of depression, of sadness, of irritability is becoming more and more intense, and it's more than 2 weeks, then we may have to look into that it potentially could be postpartum. All right, so postpartum. Then we also have postpartum psychosis, and this is rare. This doesn't happen often, but with the psychosis, there's additional confusion, disorientation that may occur, obsessive thoughts about your baby that may occur, hallucinations, sleep disturbance, paranoia, wanting to harm self, suicidality. So again, with the psychosis, everything's even more bizarre and even more strange and weird. So if we're noticing things that are strange and weird and bizarre, then we have to pay attention to what could that be. And so again, it's important, again, when we're talking about prevention, when we're talking about making sure we get the help, we don't want things to last too long. So again, if we're noticing things are occurring, it's been 2 weeks, then it's time to seek professional help, okay? Just a quick thing, that postpartum occurs in fathers as well. I don't have the statistics on that, but that is something that I'm curious about, because postpartum, and I've heard that from some of my male clients, that has occurred. But postpartum is something that occurs in men as well. And so I'm assuming because they are there with the women as they're experiencing some of the things that the women is experiencing, that the men is also taking on some of those attributes. And so postpartum do occur in men. So just wanted to put that out there for the women who have men in their lives, the fathers in their lives, that this occurs in men as well. So if we're noticing that the men is having depression, the men is having these things that after a childbirth, that may be something we need to explore as well. Okay. Let's see. There's no single cause of this, okay? There's no single thing that causes women to necessarily have postpartum. Again, with the postpartum depression, because we just delivered baby, and again, our bodies are going through changes during the pregnancy. Our bodies go through all things during all parts of the trimester, every day along the way. Our body's going through all kind of changes, which is creating changes in our hormones, in our estrogen, in our progesterone, and all those things. So all those changes in our estrogen and progesterone is creating changes in the body, which then affects our mood. Okay? And then our thyroid is also affected. And so because our thyroid is also affected in terms of our hormone, the hormones that's affecting our thyroid, so all that could affect as well, be a cause of postpartum. So those are things to pay attention to. So again, when we're experiencing these things, it's important that we contact our medical doctor and have conversations with our doctor saying we're feeling this, and we know ourselves more than anyone. So if we're noticing that things are not as normal and not if it feels different, it's one thing to know when we get sad and to know what it feels like to be sad. But then we're noticing, this doesn't feel the same kind of sad. What I'm experiencing feels different than what I felt before. When we're noticing these things, it's important we speak on it. It's important we let our primary physicians know about that. Okay? So our hormones, again, we know our bodies more than anyone. So informing our doctors about that. As well as our emotional changes. So again, during pregnancy, emotions are impacted as well. Okay, our environment plays a big part as well as in all this. Okay, during our pregnancy as well as after the pregnancy, childbirth. Again, how our environment, whether or not we are supported or not supported, and all those things. Okay, plays a big part um, in how we're in how we're managing our mood and how we're managing postpartum if that's occurring. Okay, so risk factors are things to pay attention to. Um, Again, I have a few clients who are coming to me for depression, history of trauma, history of things, and one woman in particular, she's wanting to get pregnant. She's wanting to have a family, and that is a conversation that she and her husband and we have about, okay, what will that look like? What are the things that we need to put in place? What are some protective factors? What are um, um, different things that we need to put in place if this is something that you all choose to do in terms of a pregnancy? Because the pregnancy itself may become difficult because of her past history of things, and emotionally, what kind of support is she going to need? What are the things we need to put in place emotionally to for protective factors to make sure that she doesn't get into a state of depression, because she does have a history of depression already, so it doesn't become worse, or as much as we could manage it, what are some things we could put in place to try to manage it the best we can? Okay, and a lot of this, it's about when we look at risk factors and understanding risk factors, it's not to say, oh no, don't do that. Oh no, you can't get pregnant because you have a history of this. Or no, you can't do that because of history. It's with the history, knowing that is what are the things we could put in place to safeguard, to safeguard us. And so knowing that she has a history of depression, it may be after the pregnancy or after childbirth, her parent may come over and spend some time as a way to kind of help out, right? And so these are things we would need to put in place, rather than not put anything in place because we're going to assume everything's going to be fine. With risk factors, the things that we know of as risk factors, let's go ahead and put some things in place. Okay. So someone who has a history of depression, of bipolar, or even has a history of postpartum, depending on their previous pregnancies, then that, of course, puts you at higher risk of having postpartum. Okay. Someone who has a family history of depression, if their mother had postpartum, then that may increase their chances of having postpartum as well. All right. Or if other close family members have had history of mental health, and those are things to pay attention to and be aware of as well. Okay, stressful life events, whether or not you lose a job, whether or not you're having to deal with physical health issues, whether or not you're dealing with a recent loss. All those things can impact, again, now that you've just had this baby and your body's going through changes. All these other factors, stressful factors in your life, may also impact your own mood, and whether or not baby blues turns into postpartum depression. Okay, and so those stressful life events are things we have to pay attention to and be aware of, and put things in place to manage. Okay, sometimes as women, if we're having difficulty breastfeeding, having that difficulty breastfeeding could often lead to intense feeling of sadness, or then in turn turns to postpartum depression. If the baby's unhealthy, if the baby has medical problems or medical complications or health complications, again, as mothers, we take on that responsibility, we take on that burden, then that can also potentially lead to postpartum depression as well. The other thing, too, is, and I get this a lot with clients, where there may be a mixed about the pregnancy, whether or not the woman wasn't sure if she wanted to be pregnant or not. So that itself can also bring some postpartum depression as well, if there's some concerns about whether or not you wanted to be pregnant or not. Okay, as well as substance abuse. And so again, if the woman has substance abuse history, then we have to be aware of that and note that as a potential risk factor for postpartum. Okay, and like everything, when they go untreated, it could become a bigger and bigger problem. And so with postpartum, again, it's a 2-week window to kind of look at, see what's going on. If we're noticing these are happening after 2 weeks, the behaviors continue after 2 weeks, the depression, the anxiety, the hopelessness, the symptoms we talked about earlier, excessive crying, difficulty bonding with the child, intense irritability. If these feelings are continuing past 2 weeks, 3 weeks, 4 weeks, months, then we definitely need to seek mental health, a professional help. Okay, and so yeah, definitely it's important to do that, because again, when we don't do that, then it can become a bigger issue like major depression, or bipolar. It could become another diagnosis. So then we may get co-occurring diagnosis, which is multiple diagnosis. So we're starting out with the postpartum, but now we have postpartum on top of something else and something else, other diagnoses. And so when we let things kind of compound, when we kind of let things, when we don't do certain things to deal with what's going on, and we're letting things compound, the more we let things compound, sometimes more symptoms and more diagnosis, other things are also compounding too, once you get the help. So as soon as you can, it's best to get the help. The sooner the better. Okay? I want to talk about the suicide crisis line, and that at any point, if I'm talking to any particular woman out there who's experiencing postpartum or who's in a state of depression, postpartum or otherwise any kind of depression, then there is the suicide hotline, and that number is 1-800-273-8255, 1-800-273-8255. So that's the National Suicide Hotline. And so what does it look like when we go into therapy? And so, yes, I've had many a times women come in after childbirth, whether it's what I've seen with postpartum. Sometimes there's a complication in the childbirth. There's a complication in the childbirth rearing process that's going on. And so either way, what leads them here for therapy is they notice that their sadness and their depression, and that it doesn't feel the same as usual, and that they're having a difficulty bonding with their baby, and that their irritability, they're irritated with their child, or irritated with everyone around them, and they're wanting to come in to seek help and seek counseling. And so when we talk about counseling, depending on the individual, different type of counseling works. And so one thing I will say, when you are seeking a counselor, you have as much of a decision in that process as the counselor, okay? This is somebody you're seeking for. It's like seeking for anything else in terms of a doctor or dentist. You have a say-so in who you choose to be a part in your life in these process, in all these different experiences. So the therapeutic process, in the same way, you have a say-so in who you want to be your counselor. And so I definitely encourage people to look up different counselors and then talk to them. So I've had people who do consultation. They want to ask me questions. What's your philosophy? All these things. And that's perfectly okay to ask questions about who I am, to see if I'm a good fit for you. Because again, finding a good fit in counseling makes all the difference in that process. Okay, so we want to make sure you have a say-so in that experience, because you're going to talk about things that are most vulnerable to you. This is a difficult time. It's already a difficult time in your life that you're going through, and now you're having to add this additional thing into it, which is coming to therapy on a weekly basis or bi-weekly basis. And so you want to make sure that you get something out of it. And so part of that is making sure that you feel a connection with the therapist, and that this could be a good fit for us to do the work. And so once the work begins, you do an assessment to kind of determine, okay, what's the issue? Okay, we acknowledge that, it's postpartum. And so part of that is getting that history. And so figuring out with clients, a lot of what I do is figuring out, okay, this is what we see as the issue. Let's kind of see if we could kind of pinpoint potentially where some of that issue has come from, what has led us to here. Again, it could be a combination of things and a combination of things as well. And then the key is trying to figure out how to manage it as much as possible, right, in the things that we can. And so if it's a lot of things with our physical changes, our hormones. Again, do we need to, are there medication that we need to take? Are there things that we need to do to get our to stabilize our hormones? Do we need to consult with your psychiatrist? Do we need to consult with a doctor, with your medical doctor? Do we need to do that to make sure your hormones are okay? So, medically, because again, this is still a fragile time. You just had a baby. So medically, we still got to rule out some things, make sure medically you're okay, right? And so when I talk a lot in regards to the mental health with individuals, I also speak about, okay, making sure your physical health is okay. Make sure you talk to your doctor about that. Make sure you talk to your doctor about that. That sounds like something you need to talk about. Even though I could see how mental health plays into that, however, let's rule out physical health as well. Let's rule out anything physical. And do whatever tests we need to do to rule those things out in that way. So I strongly encourage that. And so the key would be to figure out process. Sometimes we need to do things like CBT, which is cognitive behavioral therapy. And cognitive behavioral therapy is all about changing our thinking to change our behavior. So cognitive is thinking, behavior is, of course, our behavior and action. And so cognitive behavioral therapy is recognizing a thinking pattern, and then how do we change the behavior, right? So our thinking influences our behavior. So oftentimes when we have an irrational thought, it more likely will lead to an irrational behavior and an irrational feeling, right? And so if we can manage the thinking, the cognition, then we could manage the feeling and manage the behavior as well. And so that's what CBT is about. And so through talk therapy, so there's different levels of talk therapy. If we're talking about trauma, then there's EMDR, eye movement desensitization, reprocessing to kind of pinpoint what the trauma is and how to work through that. Again, if we need to get a psychiatrist in place, then we consult with an MD, which is a psychiatrist, to talk about what we need to put in place. And so there's different things that can be done in therapy. Okay? And then on top of that, too, is making sure we are our environment is conducive to our health, right? Making sure we feel supported in our environment, making sure our environment is not stressful, or if it is stressful, what are the things we need to put in place to minimize the stress? And so, again, I have a lot of clients who's coming in with a lot on their plate, so now you're delivering. And so the role of being a mother is especially during that time when you first delivered, is just care for your body, make sure you get well, and care for the baby. But oftentimes we're also caring for other children, or we're caring for other people as well. And so it becomes hard to just make that just be the focus. And so recognizing what all we are burdened with and how that can lead to, again, more depression. And again, the person who's having that postpartum, oftentimes they get to a place where they can't move. The depression is so intense. So in turn, they're not really taking care of anything anymore. They just can't, right? And so recognizing that too. So those are just little things, little bit of information regarding postpartum. I hope this was helpful. Please contact me, DM or email me if you have any questions in regards to this. Again, it's really important to seek mental health. Therapy is, I love this phrase, therapy is dope. Therapy is healing. And so whenever people have things going on, rather than just letting the things just kind of work out itself, which in many cases some things work out itself, but in a lot of cases need some help and support for it to work out. And so my role as a therapist is to be that support to help people work through their things. So thank you so much. This is Natalie Ellis, and this is Ask the Therapist on Wednesdays with Natalie. So please, I'll see you next week. So, please follow this page and share this information with others, and I will see you next week. Thank you.